Would you like to work closer to home, save money on gas, and be rewarded for your hard work and attendance? Then Bellisio Foods is looking for you. That's right, Bellisio Foods is now hiring for multiple positions and shifts with great employee benefits, an on-site health clinic, competitive wages, and advancement opportunities. Bellisio Foods is a company that truly values their employees. Apply online at belisiofoods.com/careers.
We all make choices about alcohol. Kids make choices whether to drink or not.
Bye, Dad.
Bye-bye.
Remember, I'm going to Alex's party tonight and sleeping over.
Have fun. Hey, remind me about that party again?
And adults make choices whether to talk about it. That's true of parents and every other trusted adult in a kid's life. Kids want to know our expectations, and they want honest answers in everyday conversations. So talk with your kids and help lead them on a positive path. Because when you talk, they hear you.
Well, good morning, everyone, and welcome to the morning show right here on Main Street TV. Of course, Jennifer here to start off your morning with someone from one of our favorite places, and that is Holzer. And this is Dr. Gregory
Kloehn.
Right. I didn't want to say it wrong, so I just will have you say it. Mm-hmm. So welcome to the program.
Thanks very much.
We're so happy to have you here. And you and I were just talking off air that you started out... you grew up in Wisconsin, right?
That's right, from there originally, yeah.
Very, very cool. So welcome. We're so happy to have you here in the area. And could you, I guess, start the show by telling everybody a little bit about yourself?
Sure. Yeah, I'm from Wisconsin originally, and I was in Canton, Ohio for about 20 years working there. And then job changes and so forth with various hospital restructuring and so forth led me to look for other places to work. So I came down here. There was an opening, and I knew Dr. Bradley from residency days. He's been here for quite some time.
Oh, cool.
Good job here. So we talked, and, we had similar, job opportunities and so forth as far as what we do. So it was a good fit. So I've been here for about 8 months, and it's been good. It's been good.
Well, we're happy to have you
Thanks.
here in the area. Unfortunately for our area, your field of expertise is much needed as I think heart disease and things here in Appalachia is pretty prevalent. And you are a cardiology doctor.
Right.
So could you tell everybody a little bit about, the things that you do at Holzer?
Sure. The first thing any cardiologist should do, whether they're interventional, meaning putting in stents like I do, or not, whether you're a general cardiologist, would be preventive medicine. So we want to stress lifestyle. We want to stress weight loss, diabetic care, not smoking, cholesterol levels, things like that. Because whatever we do as far as putting in stents and so forth has to be backed up by other things besides just the stent. You have to do the right lifestyle modifications.
Healthy choices.
Right. You have to do lifestyle modification. You have to take the right medications and so forth. So there's a certain buy-in that we really have to have for good long-term outcomes. But when it comes to what I do as far as, in the heart cath lab, I put in stents for, these arteries that are blocked either totally with a heart attack or with some narrowing if they just have sort of unstable angina. We can do that too. That usually is based on symptoms and if they have a positive stress test. So we want to really be appropriate in where we put in stents. It needs to be a certain narrowing, usually 70% or more.
Okay.
And there needs to be what we call evidence of ischemia or poor blood flow on the stress test. So we need to really make sure it's appropriate and warranted because some of these blockages are 50%, for example. They're not normal artery, but they also don't need to be stented unless they really reach a certain critical point. So we want to make sure we approach that and do the right thing. And so we have certain tools we use. One is the stress test. The other thing we could do, if we find a sort of borderline blockage, we might do a pressure wire study in the heart cath lab to see if it's over a certain threshold. If it isn't, then we don't stent it.
Okay.
And we go to just aggressive medical therapy, meaning pills, and then recommend, of course, other things to reduce your risk, as we just mentioned. Yeah.
Like stop putting food in your mouth.
Well, like
Stuff like that.
like
Exercise.
weight loss, changing your diet a bit, if need be. We recommend sort of a Mediterranean diet these days, and with that, you have more of a plant-based situation. You've got fruits, vegetables, and salads, things of this nature, along with less dairy products, less cheese, less red meat, things like that. Yeah.
The cheese.
There,
I could do it all but the cheese.
It's not an easy thing, but even a small amount of that modification with medication, if you need it, to lower your cholesterol, can go a long way. So we always want to stress that.
Okay. Everything in moderation, right?
That's right. That's right. Yeah.
Okay. So you mentioned a few words that I think certainly people in your field understand, but maybe the rest of us don't. You mentioned a stress test. Could you explain what that is?
Right. So there's a few different ways we can do this. These sort of classic ways to go on a treadmill and have people walk there. You're monitored during that time. You've got electrodes on your chest, and we're looking at the heartbeat throughout each and every stage there.
Okay.
We have people walk as long as we need them to walk, and by that I mean there's a certain target heart rate which we want to achieve, and if you can do that without chest pain or EKG changes, that's a very good prognosis. You have a good chance of doing well, in other words.
Okay.
Sometimes people have trouble with that. They maybe have knee or hip trouble. They can't walk, or they're just unsteady on their feet. Then we would do a chemical stress. We would do a certain injection of a medication to simulate stress, and we get information that way. And then in many cases, we look at the heart under a camera. A certain nuclear isotope is injected. Then we can see if the heart received an appropriate amount of blood during that time in all the different zones. If it did, then that's very good news. If it didn't, then we may have a need to do more like a heart catheterization.
Okay. And so I've heard a lot of people talking about heart catheterization and all of that, and that's where you get into maybe putting a stent in and whatever. And we'll talk about that here in a minute, because it sounds like a horrible procedure, but I know that it's something that you do a lot, and it's done quite frequently, and I don't want to say not a big deal, but not as horrific as it kind of sounds. But so let's kind of back up for a minute and talk about when do you need to worry about that there's something wrong with your heart, and what can you do for preventative measures so that, no offense, we really like you, but we don't want to end up seeing you. So, what are some of the things that folks can do ahead of time? I know you mentioned not smoking and things like that, but and then also like, I guess, preventative stuff. Yeah, what can we do for that?
Well, as you just mentioned there, the main things you can do would be stopping smoking and watching your diet, moving to a more moderate sort of Mediterranean diet.
Yeah, and you can literally Google. You can find that online. You can find recipes online, all of that stuff. It's so easy now.
There's quite a bit online for the American Heart Association diet. You can do that. And then the other one, which actually has shown to be better in terms of saving lives, is this Mediterranean diet.
Okay.
So to switch over to that or gradually incorporate that is important. And I know some people think, I'm not going to be a vegetarian. It's just not me. We don't really advocate that. I mean, I think in moderation, you can still have certain things you really want, but just not as much is kind of the message there. So if people can do that and have more fruits, vegetables, salads, things of that nature, it does make a difference. This combined with exercising, trying to lose weight that way, are really important things to do. But also, it's important to, as they say, know your numbers, and that would mean high blood pressure, for example, is very important to treat. They call it the silent killer because people don't know it's there until they have a heart attack or stroke. So your primary care doctor, and there's some good ones I've met over the time here, do a good job of that. We try to follow the guidelines, which are national guidelines for certain things like blood pressure. And if we can do that and keep your pressure where it should be, that's very positive to reduce heart attack and stroke and death. But you need to know what that number is. So if you don't know that, you should see a doctor. I would say for that, that can be handled pretty well by the primary care doctors in the area.
Okay.
But if there's severe high blood pressure and doesn't respond to the classic medications, then we see those kinds of patients. So that's another aspect to do. When someone comes in, we look at all these things together. We don't just look at one thing usually. Even your main complaint might be chest pain, for example. We look at everything else. Many times, too, some people have no major blockage, but they have chest pain, and maybe because of high blood pressure.
Okay.
Possibly. So to control that's important.
And I guess, as someone who suffers from anxiety a bit and have for a long, long time, while controlled, occasionally you get the tightness of the chest, you get some chest pains, things like that. How do you know, when it's time to go see the doctor? And, that's kind of a big question. And women, I feel like tend to try to be tougher, I guess, a little bit or something, or not admit it or whatever. So how do you know when it's time to go see your doc and maybe have some tests run?
Well, it's a very good question, and it's a very broad spectrum answer. The first thing I need to say is if you have chest pain and it's recurring and you're really concerned about it, then go to the ER because we don't want to miss a heart attack. That's number one. Some people, especially during COVID, were afraid to go.
Yes.
And they did have heart attacks, and there was a very high death rate. So we don't want to have that. No. The chest pain could be from a number of things. It may not be the heart. It could be from musculoskeletal pain. It could be from something else. But we don't know. So we need to do certain things. The basic thing we would do would be an EKG and possibly an echocardiogram to look at the heart's function. And
what does an echocardiogram, how is that measured? How does that?
So that's an ultrasound of the heart.
Okay.
An echo. And we get information on how the heart pumps and also the valves, the pressures there.
Gotcha.
Many factors like that.
Okay.
Yeah.
And those are things that can be done at Holzer?
Yeah, they can be done at Holzer.
Very good.
Very, very many places can do that. And that's a good starting point. The first thing, though, would be the EKG. We really want to see what's going on there. It's also only sort of it's a snapshot of what's happening. It's not the whole picture. It's one piece to the puzzle. So you could have a normal EKG but have severe blockage and not know it. Unless you're having active chest pain, the EKG is not that helpful. You can have underlying disease. So that's why to do a stress test might be more useful, because in theory, when there are heart blockages and you're stressing and the heart needs more oxygen, you should have evidence of that. So it's a supply and demand sort of thing.
Sure. It's
happening. So we try to do a stress test where it's appropriate, and then we go beyond that to whatever's needed next.
Yeah. And here's the thing. Just because you live an unhealthy lifestyle or whatever. For example, I have a very good friend. Y'all probably know him, that we went to school together through grade school, from grade school on up. And, he's active. He was an athlete, whatever. And he started having chest pains and all of this. Everything seemed normal. Put him on the stress test, put him on the treadmill, and oh my goodness. And ended up with stents and everything else. And a very active, person. So some of this can be, just because you're living a healthy lifestyle doesn't necessarily mean as well. I mean, that's a good thing, right?
Yeah.
You should be doing that. But there are other factors involved as well, I would guess.
Another factor that's very, very important is family history.
Yes.
You can't pick your parents, as they say. And if your parents have this, or your brothers and sisters, or your uncles and aunts and so forth, have heart disease, you may well have it as well.
Okay.
And even if you have minimal risk factors, and the main ones, once again, would be smoking, high cholesterol, diabetes, family history, cholesterol level. Those are the main ones. even if those are all negative except for family history, you still can have very advanced and aggressive disease. So we need to know about that. So if you have a family history of your parents or anyone in your immediate family having a heart attack before age 60 and you're getting chest pain, you should be checked out at least by primary care, and they can move on as needed. And then a stress test might be indicated.
Okay.
But these are things that certainly can be major factors. But despite all that, no matter what your family history is, if you've got heart disease, we then go to the full court press, so to speak, with
Yes.
statins and blood pressure modification and antiplatelet medications like aspirin or Plavix. It's just a mix, and you have to really be aggressive. There's something called secondary prevention, meaning the occurrence of another second heart attack, and we want to really avoid that by being aggressive from the beginning once you have known heart disease. So that's where the statins come in. And people have mixed views on the statins. There's very, very, very strong data, though, that it does decrease the chance of another heart attack and also stroke and death. So
that's good. we like to hear that.
there are side effects from them, but at the same time, if you can take them, they do very, very big things for the heart and prevention. So it's good to really take that and know that.
Well, yeah, you have to weigh the good with the bad,
Yeah.
right?
Mm-hmm.
Absolutely. And keeping your ticker ticking is a good thing.
Yep.
Yeah. Kind of need it. So, all right. You mentioned the pandemic, and a lot of people, whether they were afraid to go to a medical facility, they just didn't want to go out of their house, or they just use it as an excuse maybe to not seek medical care. What would you say to those folks that haven't been following up? It's never too late, right?
No, and it goes for everything, not just cardiac, for screening for cancers as well, and so forth. Not being seen. If you were being seen on a regular basis by whatever doctor, a primary care physician, cardiologist, whatever, I would say go back, because you need to have an update on what's going on. These do prevent more significant, even catastrophic events. There's a much higher rate of heart attack and stroke during that time. Part of it was because when people had COVID, it was a hypercoagulable, highly thrombotic, clotting state. You could have a lot more clots with COVID. There's no doubt about that.
Okay.
Both in the arteries and in the lungs.
That sounds bad.
All over, yeah. And the type of clotting we were getting in the heart when we would have these heart attack patients, this was a different kind of clot than the usual. It was much more almost like a currant jelly sort of clot. It was different.
Oh, wow.
Yeah. So we knew that the virus did a lot of negative. So if that's happening, there's other things that are happening as well in an underlying way. So if you can get in to see your doctor, I would do that. I don't want to say the pandemic is over, because we always have to be vigilant.
Sure.
But there are times when you need to just go out there and take a bit of a risk and get back to what your normal was, so we can avoid trouble down the road.
Absolutely, because, prevention is key, right?
Yes.
Be proactive, not reactive.
That's right.
All of those cliches that we say, but they need to be said.
Yes.
Okay, so get out, and if you've not been back to your doctor, start with your family doc. Maybe get some blood work drawn, and get back into that normal routine that you normally would be in. Once or twice a year or whatever.
And there are very clear guidelines that the primary care physicians have for colon screening, for example, and things like this.
Yes.
And to go back and be on track for those is important. It does. Save a lot of lives. It does.
Yes.
It does unmask a lot of disease that we wouldn't know otherwise. And there's been a large wave of people coming in with much more advanced disease and trouble when they do come back. So prevention is very important.
It is. Get your colonoscopy. Nobody likes to do it. It's not fun, but do it.
It's important.
Ladies, get your mammograms. It's not fun. Do it.
Yeah, it's
All
very
of
true.
that, all of those yearly exams, none of us
That's
like.
right.
When I went in for my mammogram this year, I was talking to the sweet girl that did it. She said, uh, "I'd be really worried if someone came in and said I've been looking forward to this day."
Well, it's
And I
very,
said, "Oh, yeah, that makes sense. Yes,
it's true. It's true.
but they make it as pleasant as
Yeah.
possible." And I know that the sweet young lady that does them here in Jackson does an amazing job, and she's makes you as comfortable as possible.
Yeah.
So, that's one good thing about Holzer, I will say, is that they treat you like family.
Mhm.
You're treated well. Everybody's very kind, and you don't get that in some of the big cities.
That's true. It's very true.
So, yeah. All right. So we talked about a little bit about prevention
Mhm.
and no offense, not getting to you,
Right.
but say, we're to the point where we need to see you. What are some of the procedures and things that you do, to help that heart patient along the way?
So if we were talking about coronary aspects,
Yep.
if someone needs a heart cath, for example, these days we're typically going through the arm, the radial artery here, as opposed to the leg.
Which sounds terrifying.
Well,
Like, how do you do that?
we have a small, we numb the area up quite nicely, make sure the artery pulse is good, and then we numb it up.
Okay.
And we're able to thread a small catheter about the size of a spaghetti noodle, wet spaghetti noodle, up to the heart area, and we can then very carefully inject some contrast and see if you have blockage there. And
That's insane to me that can be done.
yeah, in the past it was done through the groin, through the large artery there,
Okay.
called the femoral artery, but they found over the years that it's safer to do it this other way. It's also much quicker.
Shorter distance, maybe?
Well, it's just
Not-
I think
maybe
the
not.
I
I
think
don't
the issue is you've got a lot of space in that groin area where you can have trouble. You can have something called a hematoma, sort of a blood pocket build up there,
Okay.
things of this nature. And it's also easier to get back on your feet and walk after this procedure. And
Makes sense.
people want to get back to their lives. They have things to do. They're busy. To sit for a day, is not easy. So we try to go through the arm if we can. Now it's not always possible. Some people, especially as we age a bit, you can get calcification or sort of a corkscrewing of the arteries in the arm, and then you can't get up safely. So we have to go through the leg in those cases. So it's not always, but I'd say this day and age, most places are doing radial approaches for these
Okay.
things. And if we need to put the stent in, we can do it through there. We don't stent to every blockage. It has to be really warranted, and by that I mean 70% or more.
Okay.
So if you've got one that's kind of questionable, we might do a measurement with a pressure wire, for example, to see if it's really over a certain threshold or not. We want to make sure because anything we do invasively does have some risks, so we want to make sure it's worth it. Not to mention, when you get a stent, you're going to be on a blood thinner for usually 6 months at least, and often a year. There are several that we would use. Sometimes these can cause side effects like bleeding.
Yes.
So it's important to make sure it really is the appropriate thing to do. So the
Okay.
combination of the stress test and then possibly this flow wire gives us a pretty good idea of whether it's warranted or not.
So what causes the blockages, for a human? Is it?
It's plaque. It's atherosclerosis, and as we mentioned before, the major risk factors for that occurring would be smoking, high blood pressure, high cholesterol, diabetes, family history. Everyone has plaque. They know this starts in your 20s. It's called a fatty streak. They did autopsies.
A fatty streak.
Fatty
Okay.
streak. They did autopsies on soldiers years ago in the Vietnam War, as a matter of fact, and they saw these little fatty streaks there. These are young, physically fit people, but it starts young,
Okay.
and then over time it slowly progresses. And when you get more cholesterol buildup there, then you can have narrowing of the artery. Then you can have plaque rupture, and then you can have chest pain from that. So that's why it's important to keep the pipes clean, so to speak, with
Sure.
these medications and with a good diet and not smoking and cholesterol. But that's the process of what's really happening as far as the the pathology, so to speak.
And that's the thing. And I mean, if you think about it, you have to, fuel your body. So the things that you're consuming
Yeah.
is the fuel that makes your body go. And while we all like to eat, Little Debbie snack cakes and things like that, you
Yeah.
think about the stuff that's in there that your body's absorbing, and it starts to like hit home, like, oh, that's probably going to stay somewhere.
Yeah.
So as a cardiologist, I'm sure that you eat a snack cake or two occasionally, but you probably, I guess you would maybe be more in tune to what you eat, I would think, right? Personally?
Yeah, I mean, I try to stick to a Mediterranean diet as much as I can.
Because you see this every day.
You see it a lot. But I do have, pizza now and then, steak. It's, you can do these things just
Sure.
within moderation. And also in the Mediterranean diet, you can have, white meat, for example, turkey, things like that, and also fish.
Yeah.
You just can't fry the heck out of it. That's not a good thing. So
grill it. It's fine.
yeah, there are some things you don't need to go to a pure vegetarian diet. That's not what I think people would not be happy with that. Even though I have to say, many years ago when this was during World War II, they totally took the meat out of one of the countries, I think Sweden or Norway, when the Nazis invaded. They took all the meat and gave for their own soldiers. So that country had no meat, and their cholesterol levels and their heart attack rate just went down, straight down like coming off a cliff.
I can imagine.
There's no medication that can do that. So if you did suddenly switch over, it does huge things. It's just not the way we definitely want to eat every day.
It's so boring, but it's so good for you.
It does do very important things.
Yes.
So to know what this is, how powerful this is, and how to moderate somewhat is really crucial. So anybody that's had a heart attack, chest pain, PAD with the stents in the legs, which we also do, needs to really be on a cholesterol savvy diet with medications. There's a certain goal we have for the bad cholesterol. It's 70 or lower. And this is really important to try to achieve. But to do something is really important. Now, if you can't tolerate statins at all, there are some things we can do. There's a certain injectable shot that we can do. Insurance has to approve it, of course. But if that's done, that's a possibility as well. Most people, though, they can take a certain amount of statin. But if they have trouble like muscle aches and pains, especially in the thighs, the bigger muscles or the joints.
That's what I was going to ask you. What are the side effects that people couldn't be able to take?
Those are the main ones.
Okay.
And most people have these side effects the higher the dose you go. So we try to be finding, a certain compromise spot, sweet spot, so to speak, where we can give you the right medication to bring your cholesterol down, but not cause a lot of side effects.
That makes total sense.
Yeah.
Okay. All right. So besides the stents, is there anything else that one does to help folks out with their heart?
Well, CHF is a big thing as well, congestive heart failure. And
okay.
We're finding out the normal pumping ability of the heart, called the ejection fraction, is about 60%. So if it's weaker than that, lower than that, that's a certain kind of congestive heart failure with a reduced ejection fraction. There are certain medications we can give to really help that to improve. And you want to do that for a number of reasons. One is to keep people out of the hospital, but also we know if it gets very, very low, we need to make sure we can potentially. We have to know the reason why it's happening.
Yeah.
It can be from blockage of the arteries, or it can be from something else, non-arterial blockage. These are two big sort of vague groups, but we want to make sure that if it is reversible, we try to do the best we can to do that. Sometimes stents or open heart surgery can do that. In the other group, where it's the muscle, it's just medication treatment for the most part. There's a few different exceptions, but that's where we are for the most part. The other group, though, altogether is occurring. It's another kind of congestive heart failure from basically the heart not relaxing enough. The ventricle can't relax, and as we age, this is quite common.
Okay.
It's with a preserved ejection fraction, as they say. but you get short of breath, for example. It's a thickened ventricle over time. There are new medications that have come out for this as well. That's a nice breakthrough over the years. We didn't have much to offer for that.
Yeah.
So this we can do as well. Whenever someone comes in, though, we try to assess all these things: chest pain, shortness of breath, what the rhythm is. Are you in atrial fibrillation, for example?
That's a whole other story, right?
Whole other talk, whole other segment we can do.
Right.
But just to make sure that, first of all, is it really atrial fibrillation or something else? We might have to get a monitor. The other thing is you should be, in appropriate cases, on a blood thinner to prevent stroke, because there's a 6 times higher rate of having a stroke with atrial fibrillation than there is if you don't have it. And
Yes.
the top of the heart and the bottom of the heart are out of sync, and you get clots that can develop in the top of the heart. And these are big clots, and they can go up to the brain, causing severe stroke. And
Yeah.
we've all seen what that can look like. So it's a horrible thing to have, and we want to avoid that. So a blood thinner would be appropriate there.
Okay.
So we want to cover and look at all these things when you come in. It sounds like a lot, but we have a systematic approach, and we look at things that way. So that's the main thing. If someone has severe blockage in multiple arteries and they need something else that we don't offer, like open heart surgery, we send patients elsewhere, wherever they want to go, Columbus or Huntington, for example, to do that. And we've had good success with those doctors.
Where do you, how do we get from, like why can't I think of the word, the procedure you just talked about, the catheterization. How do we get from that in a stent to open heart surgery? What are...
So it depends on how many blockages there are at that time and where they are. Some are pretty simple and straightforward to fix. Others are very complicated. There's one that can be very sort of at the beginning of the artery, left main or LAD, they call it. These areas sometimes are better treated with surgery than with a stent. And so we might send a patient on to another place for work there. There's an artery in the chest wall called the internal mammary artery, which is a very good one that we use to bypass the LAD, which is the main artery in the heart. And the long-term patency, the long-term chance of this doing well is very, very high. So if someone's a diabetic, for example, and they have very tight blockage or a lot of calcium, it's a difficult to treat area, that operation really can be, not only life-saving, but also can give you very, very good results for many years. So if people need that operation and the right patient, I think it's really important to refer them on to a place that does that.
Sure. Now, nobody, wakes up in the morning, it's kind of like, your mammogram and all the other things, and says, I can't wait to have open heart surgery today. Because needless to say, getting to your heart is a little difficult from the outside in. And but it's a thing that doctors do every day, and it's just a little bit more invasive, I guess. Actually, a lot more.
Right. I mean, there's such a big spectrum that we're talking about. If someone comes in with chest pain, they're having a heart attack, or they've had chest pain for the past 12 hours, they need to come into the hospital to the ER for sure.
Yeah, just go. Don't be proud. Just go.
Just go, get it worked out, get it looked at. It might not need all these different things we're talking about, but it also might. And if you miss that opportunity, you could have a lot of long-term damage to the heart. You could even die from it, obviously. So we want to be careful about that, and recommending that people go and get assessed, get checked. If you have a heart attack, we hope to, if we get the stent in early, we can save, a lot of heart muscle, which is obviously very important. That can be life-saving. So we do that. We do heart attacks here on a regular basis, and that's been very good. There's been a real problem with getting people to other places rapidly. It could take a long time to get someone to Huntington or Columbus. So doing it here rapidly has been, I think, a huge benefit. People come in very sick sometimes, and they need that artery open right away. Otherwise, they might not make it anywhere else. So it's been good to have this opportunity here in the area.
That's why we're so fortunate to have you here.
Yeah, it's been good. I've been here for 8 months, and of course, Dr. Bradley's been here for a number of years, and so it's been good. It's been a good combination. Yeah.
Yeah. Well, thank you for choosing our area.
Sure. And as far as peripheral arterial disease, this also has been a big issue. If someone has a black toe, for example, it's often gangrene or necrosis. This has been a problem because people often delay going to a doctor, especially over the COVID time. And that delay has been a huge issue because when you finally see someone, because the pain is so intense, or the foot is really getting more involved, you may be, very late in the process, and then
Oh,
amputation
yes.
might be the only good option. So, if someone has that, or if they have pain at rest in their feet, or black toe, or even what we call claudication, which is pain only when you walk, you should get checked out. If you've got a black toe with necrosis, especially that
Yeah.
very soon, a lot of times the podiatry doctors in the area or wound centers see these patients, and they do a good job, and they send them on. In those cases, I'm sort of the plumber. I try to open up the arteries there, and then they help with the other parts. And it's a team approach for sure.
That's a great thing about Holzer as well,
Yeah.
because everybody's knows everybody and can work together.
And we can usually get people seen rapidly for these kinds of things. But in the past, I've spoken to a number of podiatrists in the area, some outside the city and some here. To get someone to be seen in another place, even same areas, Huntington, for example, or Columbus, it's taken 6 weeks.
Yeah.
And that's just
It's rough.
not going to work. So we know that the sooner we can get things diagnosed and get a sort of roadmap to the artery, the better. And if they need something else in another place, we certainly send them on there. But it's much easier if I call a certain person or a physician I know about this sick situation, sick patient. It'll get them in much quicker than if they sort of go through the usual route. So to be seen and to be assessed early, I think, is really crucial.
Yep. And that goes back to the prevention is key, right?
Prevention, and also knowing when you need to not sort of doctor yourself, so to speak.
What? None of us do that.
I mean, to a certain degree, driving is difficult, but you need to kind of go out there and be assessed by someone. Otherwise, if you keep waiting and waiting, a number of patients have said over the years that they treated themselves with a foot problem, with a black toe or an open wound with a certain home remedy, and it didn't work. Well, I want to say that we need to get more information to know just what's going on. If it's a very skin deep thing, then podiatry can certainly help with that.
Yep.
But if it's a flow problem, that's not going to work.
Nothing from the outside is going to help that
right.
situation.
It's just not. And so you're sort of not making the best choice of time in a case like that.
Well, and I think though, and especially down here, this is probably why we all get ourselves into trouble in this area is, you think that you're proud and you don't want to go, or it's embarrassing or whatever. And the fact of the matter is that's what you all are there for.
It's all over the country. I've worked in many places,
Okay.
and people often start that way. It doesn't matter where you are, what state you're in. I worked in a number of states, and it's kind of the same. If you can get by without doing the full sort of hospital thing, I get that. But then it gets to a point where it just makes good sense. So people here are like anywhere else in that sense. I do notice people don't like to drive here to very far places for their care, which I can understand because these are bigger cities and it's not easy. But we can offer a lot here, I think. People need to know that. We can offer the very important basic first steps here, like heart catheterization or a leg angiogram, just to see what's going on.
Sure.
And maybe they won't have to make that trip. There's a lot we can do here.
Yep.
We can put stents in the legs. We can go all the way down to the foot if we have to. We can do quite a bit. And if we can't, then
That's awesome.
Then we have the right avenues for the next step. But I get that it's expensive driving these days with gas prices. These are bigger cities.
It's intimidating to drive in the big cities if you're not used to it.
And the places you go to don't know you. So you want to go to a place that does, so to speak. And so I think, being seen here first makes a lot of sense. And then we can do whatever has to be done and hopefully fix it here. That's our goal.
But, and that's the whole thing is this tight-knit community within Holzer, and that's what is always appreciated by, myself and I know our family. Yeah. But think of you kind of as the concierge, I guess, if you will, that if you need referred somewhere else, you have an advocate right here
Right.
to get you to the proper,
Right.
you can't just be out there flailing around not knowing what to do. And I
Yeah.
think so many people are, in that boat.
Yeah, I think that's true. COVID disrupted things so much.
So much, yes.
And we also see that if someone does need to go to another hospital, there's a lot of bed shortages elsewhere and very long
There
delays.
are.
And it's actually
It's bad.
it's not just a bed issue. It's more of a staffing issue. Many of the nurses that have worked in those areas, are no longer there for a number of reasons.
Yep.
And so to get a bed some places can take several days. So it's a triage sort of situation.
Yes.
That's why we need to know if it's an acute emergency, we can often get them there, but they really that has to be very few and far between. And the other issue too, of course, is the weather, especially on some of these rainy nights. If there's fog or if it's snowing, they won't fly.
Sure.
And driving someone 2 hours who's unstable can be risky. So we want to really try to do the most we can here, and then get people transferred safely as soon as we can. But it's sometimes challenging because you don't have a lot of easy resources at your beck and call with various changes.
Yep. Well, that's why we're happy to have you here, as I said before.
Yeah.
All right. So how does I'm assuming that, whether it be podiatry or the ER or urgent care, somebody can refer a patient to you. Can they get directly to you? Do you need to start with your family physician or the ER or something like that? How does that work?
It's a great question. I think if it's a very serious problem like chest pain, again, severe chest pain that's unrelenting, that keeps going, or that's coming, intermittently on and off. If it's really bad, go to the ER.
Yes.
Just
go.
Don't chance it. Yeah. And if it's kind of occurring with just exertion, things like that, then it's more of a chronic, stable pattern. You could see your primary care doctor. And the reason I say that is because many times insurances will require that to let us see you.
Of course they will.
and unfortunately, these days, things are run more than we would like by insurance.
Yeah.
It's just the nature of medicine right now.
Don't get you started, right?
It's another talk.
That's a whole other day.
But we have to work within that system.
Yes.
And so I would say that's probably the best place to start. Now, if you've had a previous stents in the past, or you've had a previous heart attack, or documented blockage sometime, then you're at much higher risk for another problem to occur. So if that's the case, and you just need to establish, then you may be able just to call the office and do this.
Okay.
It just kind of depends. But going through your primary care doctor is, if possible, if time and symptoms allow, is very efficient because they can get them in. They have their office, call our office, and so forth. And
their people call your people.
That's right.
It's fine.
and it gets things done. There could be a wait if people are having a lot of pain and trouble and they have to wait for a long time. Then please call us and let us know. Sometimes it's not that clear just how serious things are. We want to be as clear as we can. But we want to be, able to see as many people as possible. Yeah.
Yep. And here at home, which is great.
Right.
Speaking of, where do you see patients? I forgot to ask you that question.
So 3 different places. The main place would be the Gallipoli's office there.
Okay.
Holzer there, and then also here in Jackson, and then also in Athens. So 3 different places.
So you're traveling a lot, huh?
Right. 1 day a week. In Jackson and Athens every other week. So most of the time at the main campus there
in Gallipoli's.
Yes.
Okay,
Yeah.
Which is still close.
Right. It's not
better
that
than
far.
driving to the big city, whichever big city that might be.
Right.
Where are you seeing patients in Jackson?
At the Holzer facility here.
At the hospital or at the clinic?
At the hospital.
Okay.
There's a professional office area there. Yeah. So right there.
Okay.
There's a cardiology office there. So
just wanted to clear that up.
Yeah. Yeah.
I would love to know the amount of people that go to the wrong building.
This unfortunately happens, and we feel we feel, well, that's
Luckily,
possible.
they're not too far apart.
Right. We feel bad. Sometimes they go to the wrong office altogether, the wrong city. So we always recommend, please call ahead and make sure, double check, so to speak, because every day I'm in a new place. It seems like some days, even though I'm not quite that bad, but
I don't know where I am today.
It can be challenging, and then for someone to get transportation in, which is very common, and then you're there in the wrong place. It's not a good day for anybody, that's for sure. So we want to avoid that.
Correct.
Yeah.
Okay. Well, is there anything else that you would like to tell our viewers before we let you get out of here for the day?
Well, with regard to the non-cardiac things, as far as legs, they do have a vein center there at Holzer, and I work there as well. So I mostly do the bigger veins.
Okay.
We do ablations on those if need be.
What is that?
So that's closing down the bad vein. What can happen if you've got a lot of discoloration or open wounds, like to the shins, for example? This can be from what we call venous insufficiency, which means the valves don't close that correctly. So blood seeps down. Instead of going up like a ladder, up, and up, blood will pool back down and stay in the lower extremities. You'll get swelling. You often get skin discoloration, heaviness, achiness, swelling, throbbing, itchiness. Okay. Those are common things. If you have an open wound, especially, or even those major symptoms, you could be assessed for venous insufficiency. And if that is there, we do an ultrasound to see if you've got flow trouble. We could close that potentially, and that can help a lot of people.
Gotcha.
There's also smaller things like sclerotherapy. These are more for spider veins and so forth, but also smaller reticular veins, as I call them. We don't need a full ablation per se, but this can be addressed by other people there working at the vein center.
Gotcha.
And so I think that's important to consider. That took a very big hit, so to speak, during COVID. People didn't want to come in, and I understand that. But if you can walk better, my view on this is that if you can lose weight or have better pain-free walking, and you'll do more walking.
Sure. It all goes round and round.
It's all connected. It's better for the heart. You'll lose weight, and hopefully you'll be able to have a lower cholesterol level, just a lower risk profile for the future. Because after heart attack or angioplasty and stenting or open heart surgery, you want to do a rehab process that can be done to a certain degree in a hospital setting where you have a monitoring and so forth. But some people can't because of distance or other things or work.
Okay.
So we want to have them get up and walk and move, and hopefully avoid what just happened to them from happening again. So to get them into a better weight structure, which will lower your blood pressure, is crucial. So part of vein work is that, I think. If people can have that done, it really can open up some good avenues. You keep walking, you keep losing the weight, maybe you change your diet to this more Mediterranean diet.
Sure.
All these factors together, you stop smoking, you watch your hemoglobin A1C for diabetes.
Yep.
You can be a new person. If you do all those things together, you have a much better chance of staying out of the hospital and having all this stuff happen. If you don't do it, then it may well recur, and that's what we're trying to really avoid.
We're avoiding this.
That's
we
right.
don't want to end up back in the same boat.
That's right.
So while you're here, I wanted to ask you, what are the difference between the vein issues? Like you hear of spider veins, you hear of varicose veins. Are those all things that you treat or could help treat?
So varicose veins are the large ropey veins that we see, and they can be from reflux, sort of leakage of the blood going back downstream. That's often the case, but not always.
Okay.
So when someone comes in with these symptoms, again, heaviness when you walk, achiness, swelling that's worse at the end of the day,
okay,
itchiness, throbbing, these are classic for chronic venous insufficiency. And if these are very severe, and we can find a reason for it with this reflux test in the greater saphenous vein that's in the thigh.
Okay.
If it's over a certain threshold, insurance often will pay to have that closed, and that can be a very nice thing. Many times, though, it's purely genetic. So if your mother had this, for example, or your family members had this, you may have it, and you may not have reflux. You just have these varicose veins. So those can be treated at a more local sort of level. Some options would be sclerotherapy, which is injecting a certain sclerosant, which can close down these vein walls, which can have them disappear. Other
Okay.
times that they can do phlebectomy, taking the actual vein out, and so these are things that can be offered. And then of course spider veins. These are just
Ugly.
small things that
They're just ugly, and we all have a
the,
spot somewhere that we.
those can be from a combination of all that we discussed, or they can be totally separate by themselves. And they do injections there for that as well. That they'll be talking about, I think, in the near future. But
Okay.
these are things that they often recur, and if you fix them, 1 year, then the odds are fairly high that they're going to come back. They're based on number of pregnancies for women, so
It's God's sick and twisted humor is what it is.
I think progesterone and other things are a major factor there. So that's just a thing to consider.
Yeah.
But some people get this done every year or so. Some women do that, men too, but mostly females. They get this done on a regular basis,
Yep.
and I think if it makes you feel better and you want to walk more, then it's a very good thing to do.
So is there, is this all a vanity thing, or are there, medical reasons why these things should be taken care of?
So-
These varicose veins or spider veins?
I think the spider veins, I guess you would say it's more of
A vanity thing?
more of an aesthetic sort of
Yeah.
thing. It's the way you view yourself, so to speak, and
Yeah.
things of this nature. And it's not a bad thing to get this done.
No.
Health-wise, there's no real health issue with
Okay.
spider veins per se. With the other bigger ones, there can be issues.
Okay.
You can get phlebitis with these things, which is inflammation of these veins. They can become infected.
Yeah, we don't want any of that. That sounds horrible.
And the other thing is, if you have a lot of pain when you walk, your legs are heavy, you don't want to do it, this is going to make you gain weight overall.
Right.
You won't exercise as much. So secondarily, indirectly, it does affect the heart in that sense. Now, if you've got large problems with wounds involving the shins, for example, let's say your shins start to turn brown, that's because the red blood cells have opened up and iron has leaked out. So you get this
Oh,
brown
my.
skin color. It's very common. It's not a major problem, but if you get a lot of pressure build up, you might develop wounds there.
Sure.
If that happens, they can usually be treated with compression, with wraps, elevation, and walking, but the odds are fairly high that they're going to come back because you've not changed the pressure involved. So these patients, I think, should be addressed by someone in a vein setting and,
Okay.
and seen. And to close down that bad vein, the greater saphenous vein, can make a big difference for these patients.
And I guess back full circle is, just don't let things go too long. We have solutions here, right here in Jackson and Gallipolis, and we have folks like you that are there for the patients, and just don't let it go so far.
Yeah, there are things we can offer, and if we can't offer them, we know other places that can, and we can get you in to see those people. But the main thing always goes back to prevention. And if someone, and the other thing too, with regard to a lot of this vein disease is sleep apnea. We've not talked about that. That's a whole other thing too. But
Okay.
if someone snores, for example, then you may have something called sleep apnea. And if that happens, you have a lot of pressure, pulmonary pressure. It translates down to your legs. So it's very common to have that increased venous pressure working in your legs. But also, there's also a very big connection with arrhythmias, heart arrhythmias, and sleep apnea. So we really recommend, if you have that, to be seen by a pulmonary doctor, get a sleep study, and then you may need to wear a mask, which people have a lot of concerns about that. They really feel like it's something from the Middle Ages or something.
Yeah, like you're tethered to this thing.
It's really not. They've made a lot of advances. They've got these very small nostril sort of pillows that they have, so to speak.
Okay.
The old face mask thing, like a hockey game, is not used anymore.
Well, that was also if you're claustrophobic or have
That's
anxiety,
right.
that's a horrible thing for somebody
Right.
to have to endure.
But there are many, if your breathing stops many times at night, and that's what a sleep study shows us, you really have, a lot of inefficiency. Your heart your heart slows down quite a bit. You get arrhythmias during this time. Your breathing is very erratic. You can't sleep well. Your REM sleep is disrupted.
Sure.
So people feel much more rested after they've got this treated. They can do much more. They tend to lose weight. All these factors are helpful. And we know many football players, for example, bigger people have been very big for a certain part of their lives. They stay big, and they get sleep apnea, and they often arrhythmias during sleep are not uncommon with this group. So it's really important to have this considered.
So again, just have it checked out.
Right.
Yeah, absolutely. Okay, so we have a couple minutes left, so I'm going to put you on the spot here.
Yeah.
All right, so we were talking about the Mediterranean diet earlier. And what would be some of your favorite dishes to eat on the Mediterranean diet?
Well, it's a nice variety you've got, but for example, a Greek salad, is quite good. There's a little bit of cheese in there, so you have to be kind of careful with that. Don't put a huge amount in there, but we're talking about that kind of thing. that kind of thing with lettuce and vegetables and things of that nature, fruit. So salads are a good way to start, and just make it as you can put nuts in there and beans and tomatoes and onions, things like that. Start with that. If you do that, you'll partially fill up your stomach with a very good thing, hoping to have less of an appetite for other things. Decrease your amount of carbohydrates, and stay away from the red meats and heavy cheeses a lot.
Okay.
That's a nice thing to avoid. And then as far as other things, you can have fish, white meats like turkey, things of this
So you're
nature.
safe at Thanksgiving?
I think you are if you stay away from certain things, but
You mean I can't eat the noodles and the dressing and
in moderation.
mashed potatoes and
Moderation. Yeah.
Hey, that's a day where moderation. Come on, folks.
That's right. Yeah, everything is it's a marathon. It's not a sprint. And
Correct.
we want to find ways to really modify and change the DNA of your life, the basics of it, and it takes time and it takes a lot of discipline. But if you do, it does pay off. And the hope is you'll have more energy, you'll exercise more, and you'll stay away from people like me in the extreme situations,
No offense, but we'd really rather see you in a social setting than a medical setting.
And just the preventive aspect. I mean, I see people in the office for a whole spectrum, whether they've just come from a heart attack or they just had leg stents, or they're just there for, shortness of breath, vague chest pain. I mean, I see them all. So hopefully we can get to a point in the beginning early, and we can treat those basic things and not have to escalate. But I treat them all, even atrial fibrillation and CHF. That's a big part of the practice as well.
Yep. And the whole thing is just get in, see the doctors, and get started.
Right.
And get a game plan. And you're going to feel so much better once you have, a plan for your care instead of floundering out there and not knowing what to do.
I think so. And when people do have significant weight loss, they can do very positive things. Like they can get off insulin in some cases.
Yes.
Which is a huge benefit.
Big deal.
Your blood pressure comes down several points during that time. And just walking, you get the endorphin release in your brain, which many people feel is a stronger stimulant than an antidepressant medication. So if you walk 20 minutes a day with an increased heart rate, without phone distractions, so forth, you get
take some me time. Seriously,
you really have to. You have to carve it out.
Like really,
it's crucial to do that. If you do these things, though, you really can make a big impact. And the antidepressive effect of the endorphin release is huge. And you keep doing that over and over, and you'll kind of get into a pattern where you miss it if you don't do it.
Right.
It's a very positive thing.
Yep. Absolutely. All right. One final question. What is your favorite part about working at Holzer?
Well, it's just been good because of the patient interaction and the staff. It's been a good staff setting there. It's a nice sort of local atmosphere, so I like that about it. So it's been very positive in that sense.
Good. Well, we're happy to have you here in the area.
Great.
All right.
Okay.
And if somebody would like an appointment with the doctor, of course, you can call the Holzer main number and they'll get you in the right direction, right?
That's right. Yep.
Okay. Well, thank you so much for spending your morning with us. It's always a lot of fun talking to our friends from Holzer. And we will be back here tomorrow. James, what are we doing tomorrow?
Tomorrow, we have Strongman. Gonna pull a school bus or something.
Okay.
I
I'll bet
think-
he has a strong heart.
I hope so.
All right. Well, we'll be back tomorrow and it will be a lot of fun. So thank you so much for tuning in and we'll see you then. Thanks for watching. Bye-bye.
This just in.
The Telegram News has a new website.
thetelegramnews.com.
Same dedicated coverage.
Same trustworthy news with a brand new look.
Covering Jackson and Benton counties and surrounding areas.
Locally owned and operated, thetelegramnews.com has its finger on the pulse of the community.
Stay up to date on local events, high school sports, and breaking news.
thetelegramnews.com.
Subscribe today at thetelegramnews.com.
Check it out.